the lower limb. My name is Muhammad Ibrahim.
My name is Ikhwan. I'm Imran.
And my name is Mati.
Thank you so much. Enjoy.
Let's go!
Okay, hi. Today I'm going to do some special stuff for the lower limb. So first special test, I'm going to do famous test. Okay, for that test, I need the patient to supine lie on your back. Okay, the purpose of famous test is to check the sacroiliac, either there is a pain or not, which is we call as sacroiliac pathology. So for that, I need to make the patient in figure of 4 position. I want patient have to put their one leg to opposite side of the leg and make sure the therapist's hand have to stabilize at the ASIS, and the other hand have to press downwards. Any pain?
No.
Okay. If there's no pain at the sacroiliac joint, that means there is a negative sign. If positive sign, there is producing of the pain at the sacroiliac joint. So next test we're going to do for the over test. I want the patient to lie in side lying. So usually for over test we look forward to the ITB band, iliotibial band, either it's tight or not. So that I need the patient to be in side lying. So need to be flexed, and the therapist's hands is supposed to be stable at the hip, and just lift up the top leg and then just bring backward, and patient have to be relaxed, and I have to let it go immediately. If the patient's leg is hanging, that means there is a tightness on the ITB, then which is a positive sign of over test. If negative sign, the patient is able to bring their legs to downward. Okay, next I'm going to do for Thomas test. For that test, I need the patient to sit at the edge of the bed. Okay. Please have a seat over here. Please sit here. So for this test, we're going to check your adductor muscle, either it's tight or not. So for that, I want to, we just focusing on one side. I want you to hold your right leg below the knee and just lean backward, and you just touch the bed. And the other leg is supposed to be relaxed. Very good. Okay. So for this, we have to check on the opposite adductor. Either it's tight. If it's tight, the leg are willing to lift, pull up by themselves. Relax. So negative sign, the leg unable to pull up by themselves. So next test, we're going to do triangle test. For that, I need the patient have to be in position which is standing upright. For this position, I need the patient to lift up their one leg, and we are going to focus on their glutes region, glutes level, either it's going down or just maintain at the same level. So can you lift up one leg? So that means the gluteal region is in a line, like same level. So that means that is a negative sign of triangle sign. If positive sign, the glutes of unsupported leg will be dropped down, as you see here.
Okay, hi. Now I'm going to do Leishman test. So first, the patient needs to be on supine lying. So patient supine lying. Then we need a towel for support. So we flex the knee 20 to 30 degrees and put towel on the bottom of the calcaneus for support. So one hand put under the gastrocnemius or tibia, one hand put on the femur or hip for stabilize. So this hand, my right hand will pull anteriorly. So ready, 1, 2, 3. So positive side, there will be excessive anterior translation. So the purpose of this test is to check the integrity of the ACL. Next, we're going to do anterior drawer test. So the patient position is on supine knee. So first, we flex the knee, and the therapist should sit on the foot. So the therapist should pull anteriorly of the patient. So ready, 1, 2, 3. So the positive sign will be excessive anterior translation. So the purpose of this test is to see the LCL integrity. So next we're going to do posterior drawer test. So same position, same therapist position, and then same knee flexion. Just the difference is the force. So we're going to give posterior force to the patient. So ready, 1, 2, 3. So the positive sign will show excessive posterior translation, and the purpose of this test is to check the integrity of the PCL.
Assalamualaikum. Okay, so for me today I'm going to do valgus and varus stress test, okay, and also McMurray test. So first of all, can you lie on your back, please? Okay. So first of all, I will do valgus test. Valgus test is to check the MCL, medial collateral ligament. The positive sign will be pain and or increased laxity of the medial aspect of the knee. So knee flex 20 to 30 degree, and then the right hand or the right forearm stabilize the ankle. The left hand on the lateral aspect of the knee. So this is valgus test. So basically we push on the left hand and right forearm stabilize. So we just push, okay? So positive sign will be pain or increased laxity of the medial aspect of the knee, and this is to check for the MCL, medial collateral ligament. So this one is varus test. So basically the right forearm stabilize the ankle, the left hand on the medial aspect of the knee. So basically we push on this side, and on the right forearm is stabilized. The positive sign, pain on the lateral aspect of the knee, and or increased laxity on the lateral aspect of the knee. This is to check integrity of the LCL, which is lateral collateral ligament. So next test will be McMurray test. So basically, McMurray test is to check for the meniscus tear. So basically, knee flex, fully flex, okay, 90 degree, and then for the medial meniscus, to check for the medial meniscus, we will do internal rotation, and then we will go down medially like this. Okay, this is to check for the, we'll do repetition, is to check for the medial meniscus. Positive sign will be pain on the medial aspect of the knee. So for the lateral meniscus, same, external rotation, and then we come down like this side. So positive sign will be pain on the lateral aspect of the knee.
We're going to do a special test for ankle. We start from anti-doctors, then follow up by palliative, then the last one will be Thompson test. Okay, patient's position will be supine. It should be supine. So first thing is we're going to do is the anti-doctors, which is for ATFL ligament. to access ATFL ligaments facility. So we stabilize hand with the stabilize the tibia first with the hand. The therapist position, bend our knees and grasp the calcaneus, then put anterior force, which is pull upwards. So the positive sign is excessive intense extension. So the negative sign will be normal ligament tension. Okay. So we're gonna do a third tilt, which is supine. Patient remains supine. Then we stabilize the tibia. That is position bending our knee because the weight is lower. So then we grasp the calcaneus. Then go invasion by stabilizing this tibia. So the positive sign is ankle will be more hypermobile compared to left ankle. The negative side will be normal ligament tension comparing to the left side. Okay. So last one will be the Thompson test, which is required patients when prone lying. This is for access whether the patient has actually studied there or not. So we try to squeeze the patient's gastrocnemius look for plantar flexion of the ankle. So if patient have a plantar flexion is negative sign. So if the patient doesn't have a plantar flexion when you squeeze gastrocnemius, it's a positive sign of patient having tendon ankle tear.